It's time for an exam, but you're not the one that needs a pencil, I am. So today I'm going to be showing you what will happen in my office if you come in with a low back complaint. I'm going to go through the examinations that I have written here, and it's supposed to rule everything out from a disc to a strain to facet syndrome to any of the things that could be causing you back pain going down the leg. Thank you to Hunter for volunteering to be the patient today. So without further ado, here we go. Hunter, could you stand up for me, please? First, I'm going to have you give me some walks on your heel. Okay, now walk on your toes. Good. Now stand here and feet about shoulder width apart. Keep your hands out. Good. I observe for balance for about 10 seconds. And then if you're good, close your eyes for me. Good. No swaying. Keep your hands out. Play the piano for me. Now do finger to thumb. Very good. Okay. Now stand on one leg. Fine if you need balance. The other leg. Good. Okay. Have a seat for me. So all that I had Hunter do so far was very neurologically taxing, but it's important for me to test how the nervous system talks and coordinates for you to be able to do all the things that I had him do. So we're going to go through some range of motion if you wouldn't mind standing up one more time. Go ahead and flex forward. Good. Any pain with that?
Nope.
Then come on up. Hands behind your back and arch forward or arch backward. Any pain with that?
Nope.
All right. So you're going to give yourself a nice big hug because we could all use a hug, and rotate to the left. Good. And to the right. Good. And then finally, hands by your side. You might want to face the camera for this one. Bend from one side. Very good. And then the other. Good. All right, you can have a seat. So I'm going to be testing the lumbar nerve roots now. And lumbar nerve roots are in charge of three things: muscle strength, reflexes, and sensation. So I'm going to test those one at a time. So first thing I'm going to have you do, you're going to try to lift your knee to your chest. Don't let me push you down. Ready? Go. Good. Other side. Good. Same thing, push against my hand. Good. This way. Good. Try to straighten out your knee. Good. Good. This way. Try to bend your knee. Good. Very good. Put your feet down and in. Don't let me pull them up and out. Ready? Good. Same thing. Down and in. Down, down, down. Don't let me pull them up and out. Ready? Good. Now the opposite. Up and out. Don't let me pull them down and in. Ready? Good. Good. Put your feet on the ground. Lift your big toe up. It's fine if you need to recruit for now, but don't let me push it down. Good. Up. Good. Same thing with your four toes. Good. Good. So muscle strength on Hunter was all intact. Now let's do sensation. So if you wouldn't mind, yep, he's a trained patient. So just give me your arm for a sec. This is sensation that I'm going to be assessing for. Could you feel that?
Mm-hmm.
Okay, great. So I'm going to have you close your eyes. I'm going to compare one side to the other. Tell me if it feels the same or different.
What did?
This and this?
Yep. 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 Yep.
And now 5.
Yep.
Good. Good.
Yep.
And finally, this one. All right, so that was sensation. Reflexes of the lumbar spine are easy because there are two reliable ones, the patellar reflex and the Achilles. So, yep, just scoot back a little bit, perfect. Just relax. Good. Very good. The Achilles, just relax your leg, your foot. Good. Good. So Hunter doesn't have reflexes on his Achilles, but that's actually normal if it's bilateral. And sometimes I would do a move called Jurassic, and I already actually did it on him, and he's fine. As long as things are bilateral, they're usually fine, unless they're very abnormal. But a lack of reflex is common. So another big hug for me. So just relax, take it through some motion. Any pain with that?
No.
Other side. Any pain?
No.
Good. From here, I like to do my palpation seated because it's weight bearing. It's more accurate to what your spine is going through. So I did rotation. Okay, now thoracics. A little bit tight here. Push out a little bit. Good, now just relax your head. Good. You're going to extend this leg for me. And then you're also going to crouch forward, like that. Apply some pressure here, and then give me a big cough. Any pain with that?
No.
Now the other leg. Same thing, cough. Any pain?
Nope.
That is a very sensitive and specific test for lumbar discs. Basically applying a lot of maneuvers to increase intradiscal pressure as much as possible. If you had a disc, that would have lit them up. All right, now sit facing the corner here. You're gonna grab one knee as high as you can and then just go straight down, slowly. Good. All right, now this is, you see how high this is off the table? That to me means that Hunter has a tight psoas muscle, which is his hip flexor. Come back up for me. Same thing with the other foot. Now go ahead slowly down. This one is a little lower, but still high, indicating that I have to work on his psoas. All right, and you can actually flip and face the camera here and lay on your side. I'm going to take your leg here, so we're going to abduct a little bit and then 20 degrees of extension, and then rotate it internally as much as possible. And I want to see if you can hold this without my hand. Ready? Go. Good. This is a good test for hip, like hip muscles, like the glute medius, TFL. The internal rotation really puts a lot of challenge on it. As you can see, Hunter kind of had to externally rotate to keep it up, indicating to me that his gluteus medius is weak. I would do this on the other side, but to save time, you get the drill. So lay on your back for me. So just relax your leg. Any pain with that?
Nope.
Bend your knee, go right into some hip tests. Any pain?
Nope.
I'm going to apply pressure, kind of compress the hip socket, see if it's painful. In various degrees of motion. Any pain?
No.
And down here. Any pain?
No.
Good. Again, I would do these bilaterally. Put your feet together and raise them off about 6 inches. Any pain?
No.
That's another test that increases intra-abdominal, intradiscal pressure a lot. If he had a disc, it would shoot pain down his legs. Negative, negative, negative. I already talked about the psoas. He had a positive Thomas test, but if I palpate here, it's probably tender. I don't want to torture him because he volunteered. He was so nice. So, Hunter, I'm going to be pushing on you over here. Discomfort in the front is fine because I'm pushing on it, but if you have discomfort in the back, let me know. Any pain?
No.
Any pain?
No.
Okay, good. Here is a test for piriformis syndrome, which is a very common cause of sciatica. So I'm going to rotate your leg and then rotate it inward. which maximally stretches out the piriformis muscle. Any pain?
No.
If you have piriformis syndrome, that stretch would compress the sciatic nerve and shoot pain down his leg. All right. While you're here, we're going to do a long track sign called Babinski. Again, seeing how your nerves talk to each other, and no upgoing toe sign. Great. Finally, lay on your stomach for me. Continuing the low back, I'm compressing the sacroiliac joints. Again, this is a sensitive test. If he has pain here, this would increase the pain. Any pain with that, Hunter?
Nope.
Okay. Now for discs, this is hugely important. It's in line with the McKenzie protocol. So can you come up on a Sphinx position for me? There we go. Okay. Now if Hunter had disc issues and this position relieved it, which means it centralizes it, goes from here to the spine, then I know I'll have to give him exercises that emphasize extension. Any better or worse? Same?
No.
Same. Okay, good. Go on down. Bend your knee for me. Then you're gonna lift your leg off the table. Okay. This is a functional test. I was supposed to see which of these 3 muscles, or technically 4, activate first to lift his leg or do hip extension. I talked about that in a previous video. It should be glutes, but that's an imperfect world. Most of you guys will either have hamstrings or your erectors actually initiate hip extension. So if Hunter had his hamstrings or his erectors extending first, that would be a cause for his pain. These guys are working more than they should. Obviously, I do the same thing on both sides. And then I like to end it with some good old-fashioned palpation. See which muscles are tender, and then note it for my soft tissue therapy. So that is pretty much it. Probably about 10 minutes. I have to check the time later. This, along with your history, which you give me when you come in, gives me a pretty good shot at what you actually have. Once I examine you, I get a working diagnosis. I give you a trial of conservative care. Studies say usually 8 to 12 is ideal. And then if it works out, wonderful. If it doesn't, I refer you to someone who can better take care of it. That's all. Thank you for joining me. This is Dr. El Sayed, and I hope to see you soon.